Welcome, Zach.
Hey, Jason. Thanks, man. Thanks for having me.
Absolutely.
You doing all right today?
Doing good. Doing good. I don't think we're gonna have a huge crowd today, but hey, at least we're gonna record it.
There we go.
Hey, Bruce.
Hey, good afternoon. In the car, not on
Hey,
camera.
yeah,
Sorry
thanks.
about
Thanks for joining. I know we were a few minutes away. Um, I didn't get a ton of accepted messages, but that's okay. I'm going to record this and push this out. I'm not going to get into the weeds on a lot of things. I really just want to make sure that the reps feel comfortable. And so I just appreciate the opportunity. I know you and Joel were really, you were the guys that kind of sprung this thing. So thanks.
that. Yeah, and y'all be it. We've got the Dallas kind of zone region meeting coming up this week. Are you guys at that as suppliers?
Flying out tomorrow. So I will be there.
I get there like Wednesday mid morning. So I'll see you.
Okay,
I'll see you
cool.
there for sure as well.
Yep, you'll see me there.
Assuming that the world isn't on fire with whatever election results we have.
I know. I'm flying. I'm flying out the election day, which is crazy.
You know what? The airport is probably the safest place to be. You know,
It may be. You may be right.
I saw some pictures this morning. They're already boarding up windows in downtown DC. You know, so it's always fun to see that.
Oh my gosh. Well, hopefully everything will go smoothly.
Yeah, no doubt.
It's only going to go smoothly for half of the country. That's all I know.
But isn't that crazy? It is almost 50-50. And the other one half of the 50 thinks the other half is completely nuts, and vice versa.
Right. That's the thing. If there's no black or white, no gray.
There is.
I just want to know who at this point the undecided voter is. You know, that
Somebody who's not paying attention. I don't think.
right. It's that guy who's on like on social media the day of the Super Bowl, you know, and they're like, "Oh, is there something going on?" You know, and it's
That's
like,
right.
"No, really."
Bruce, that's why I respect the fact that you're still an undecided. You're waiting to the last minutes. I respect the mind that you have.
Well, he's waiting to see if there's any more TikToks or great commercials to sway one way or the other.
I'm waiting for that one celebrity endorsement, you know, that just isn't out yet, and
Yep.
that last town hall.
I'll be glad when the commercials are over because I'm in Georgia, and being a swing state, you can imagine what I'm getting.
Oh my God! I was talking to somebody in Pennsylvania today, you know, and it's like they've got rallies for both, you know, so it today, so it's like good gravy.
Wow.
Make it stop. So much money they've spent. So much money.
Guys, we're 2 after, so I'll give it another minute or so. As I said, I didn't get a lot of accepted messages, but I am recording, and I put together this slide deck specifically for the new hire, where they're going to kind of understand once they go through the presentation, just how to feel comfortable selling GOJO, get excited about it, and make money. So that's the ultimate goal here. So I'll give it another minute and kind of start rolling, and then we can push this out to the team.
Yep. And just as an aside too, we had a call this morning, and we've got one tomorrow as well too. Just talking about respiratory, you know, in general, and just some of the things we're doing just with some point of care testing as we kind of ramp up for that, and that really kind of kicks into effect, you know, right around the first of the year. But as far as just respiratory and doctor visits and all that stuff, obviously clean hands goes hand in hand, no pun intended, with what y'all sell. So maybe a good tie in there as well.
Yep, absolutely. Thank you. Joel, I noticed that you joined. Do you want to say any words before we get going?
No, hey, just want to thank the Henry Schein team for joining this call. This is really something that we think can be really beneficial, whether it's live or recorded. Obviously, we've had a long-standing relationship with Henry Schein. We're really excited about some of the things that we have that's going on right now, and some of the products within our portfolio that are new offerings that we think can really energize the marketplace. So really appreciate you guys taking the time to sit back here and go through this with Jason, and certainly looking forward to supporting the field in any which way we can to find some mutual success. So appreciate the opportunity.
Likewise from our side, Joel. Always good to hear you and see you. And let's move some product.
Let's do it. All right, guys, I'm going to get going, and hopefully a few more will join. If not, then that's okay too. So this is introductions to GOJO. My name is Jason Harris. I'm based out of Atlanta. So I've been in the infection prevention space for 20 years now on the manufacturing side. So almost 3 years with GOJO, reporting into Joel. So I'm the senior corporate accounts director. And I was kind of thinking, I've only been here, as I mentioned, a little less than 3 years. So it makes sense for me to do this because I know, how I felt coming on board, and kind of my thought about hand hygiene and GOJO and where they fit in. And I've learned a lot. So hopefully I can impart that wisdom. So the goal for today, we want to know, we want to talk about why hand hygiene is so important. I added a couple slides that speak to the why, and then overview of the GOJO mission, the brands, post-pandemic supply chain, how that's changed, how GOJO has evolved, our product portfolio, and the ES10 introduction, and then the support tools that we offer in the GOJO team. So as I mentioned to you guys, the goal here is for each of you to leave more comfortable and excited to make money selling GOJO products. So that's my ultimate goal. So let's start off with the why. So unrelated specifically to GOJO, just really something about the marketplace, and the grim reality is that HAIs, 1.7 million patients will require at least one of these infections, and almost 100,000 will die each year. So that's something that a lot of people do not realize, and that's why infection prevention is so important. That's my why in this market. My mom was a nurse, and that she kind of pushed me into getting into healthcare. And then once I got into infection prevention, you realize you were making a difference. So the fact of the matter is that HAIs are spread. 20 to 40% of HAI infections have been attributed to cross infection via the hands of healthcare personnel. So a lot of it is surfaces are contaminated, hands are not being washed, surfaces aren't being addressed properly. So the situation, it can be difficult, whether it's a hospital, a long-term care facility, or an ambulatory surgery center. We want to make sure we're educating. And as I mentioned, the top 10 cause of death in the United States. And hand hygiene is the single most important practice for preventing the transmission of microorganisms in healthcare. So it directly contributes to patient safety, hand hygiene. So if you walk into a facility and you see Purell, if you see hand hygiene dispenser, surface disinfection, there's a good chance they're doing the right things behind the scenes with other infection prevention practices. So let's talk about GOJO. So 75 years plus, founded in 1946. So as we're in the third generation, we're the inventors of Purell hand sanitizer. That's what we're known as. Obviously, the pandemic increased our profile. The largest away from home soap maker in the U.S. and unparalleled skin and surface hygiene expertise. So that we'll get into that because we do have within GOJO, we have experts, we have scientists. So it's not about just the manufacturing of formulation, it's about perfecting it as much as we can and getting it right. So you can see our footprint with 80 countries and 700 active patents. And finally, for this slide, we are a women's owned organization. So we're certified WeBank, and I'll send more information out to the team regarding that information. But it certainly helps you guys at Henry Schein achieve your diversity goals and your end users. Here's a timeline. As I mentioned, 1946. the company was founded. Then in 1952, the world's first portion controlled hand cleaner dispenser. And then most people don't realize Purell was not invented till 1988. So that's 42 years between the time the company was invented and then its flagship brand, which has really taken the company to a new level. So brand overview. So obviously we're known as Purell. A lot of people don't realize GOJO and Purell are associated. We do on this call, but there actually still is GOJO branded products that are out there. Provon also falls under our umbrella. And of course, there is Purell. So we still we're known as GOJO, but Purell, obviously, the strength of the brand is unquestioned. And this slide speaks to that. That 97% agree that Purell brand is a brand they are proud to use in their facilities. Okay, let's get into what we did after the pandemic. I think it's really important to understand because I know several of you on this call were around when it was difficult to really source anything, especially infection prevention prevention related. So what we did is we increased capacity. We really wanted to focus on vertical integration. So we brought forward 10 years of capital expenditures in just 3 years. So added more facilities. We're making the tops. We're blowing our own bottles. We wanted to make sure everything is in-house as much as we can, so we can ensure that we have the supply for you guys in the event we face another pandemic, and that's a very real possibility. And we do now have a strategic alliance with an ethanol partner. So we actually have ethanol that's shipped weekly into GOJO. It was really difficult to source alcohol during the pandemic. If another pandemic happens, that might be the case, but we have a direct partnership. So obviously we're going to be at a better spot than some of our competition. So let's get into the products. So a lot of people think about just hand hygiene. Maybe you've seen the bottles for some of you newer reps, but don't realize that the key to selling GOJO products and especially Purell is the dispenser, because we want to get those dispensers on the wall and we want to get the recurring revenue with the refill. But we do have that entire portfolio, including surface disinfection, including the bottles, and we'll get into that as we move on. So our hand sanitizer portfolio, it is important to recognize we have sanitizer and soap, but we have dispensed, which can be manual or touch-free. We have the bottles, as you know. We have hand sanitizer wipes, and we also have portables. Many of you have probably been on a Delta flight, and you've been handed a Purell wipe. So that's part of, so we have the different option there for hand sanitizer. But as I mentioned, we also have surface disinfection. We have the dispensers. We also have the soaps. And so this slide really just speaks to that. So ES10, which is our newest launch dispenser, that's something that we're really focused on right now, but I want you to know we have a lot of other things. And so here are the dispensers and kind of the timeline of when these dispensers came out. So you've got legacy dispensers, and I have a sheet that I'll send out to the team. So they'll understand, okay, well, if I'm using NXT, what replaces NXT? Where should I be focused? Then our touch-free system timeline, bring us up to today with the ES10, which is really just now being sold by Schein. This is a video of the ES10. It's short, but I'll let you. Those of you on the phone, obviously, not going to get All right. Thank you guys for listening to the video, and those of you on the screen watching it. So, the biggest thing with the ES10 is the maintenance. There's no battery maintenance, so the energy on the refill is really everything, and there's no other company that has that out there. So as you may know, batteries of maintenance is a big issue within a facility. That eliminates that altogether. So that's we're very, very proud of that technology. So I will send out additional information on the ES10, but certainly this is taking touch-free dispenser to the next level, whether it's soap or hand sanitizer. And this is part of what I'll be sending out. So you got 6 dispensers, 8 refills. We also have 2 stands, and we do have a stand promotion that is going on once a customer buys a refill. So part of the beauty of working with GOJO is we partnered with nearly every GPO. So as far as the portfolio, it is covered almost 100% by the GPOs. So you will have access when you walk into the door. And that's long-term care or your regular non-acute physician offices focus. So another cool thing, a lot of people don't realize this. So with dispensers, sometimes it's not just 10 that go into a facility. It could be 50, it could be 100. We do offer support. Usually that number is 100 or more. We provide the end user with their transition support to a new dispenser, or if there is a high volume of dispensers going into a facility, or maybe even group practice, then we'll make sure that we have a team that's local that will go in and install that for the end user. So it's easy to get to the dispensers, and we want you guys to order dispensers from us. There are some dispensers that are in the DCs, but the best way to do it is through customer service, get in touch with myself, and I just need the address and contact information of the end user, the number, the type of dispenser, the number of dispensers, and then we get that out really in just under 2 weeks. And so we can have that team ready to go if it is a large volume. So formulation. So when I think of formulation, I think of what we all faced during the pandemic, where we would go into a restaurant and it smelled like tequila. So I put a bottle of Patron on this slide, right? Because if your hands are red, they're irritated because of what you're using, because of these healthcare workers, they're using hand hygiene soap all day. They're going to decrease their compliance because it's irritating their hands. And then you have the risk of cross contamination. Whereas using Purell, using the brand that's trusted, more than likely the compliance is going to be where it needs, and so will have a positive impact on infection levels. So this slide is discussing the clinical impact of the dosing. So we dispense 1.1 milliliters of hand sanitizer. So that is the correct amount. Less than that is more germs, and obviously you're going to have a situation where there could be cross contamination, and so that's what makes Purell. I mean, we are committed to the proper formulation, the proper dosing, and that's why when we talk about dispensers, getting those on the wall, that's really, really important. So one thing, I put this slide on here just to show the soap disadvantages. Obviously, soap was what was used for years and years in the healthcare setting. And so the alcohol-based hand rubs are really now, that's what is accepted, and that's the standard of care. So most of the time, if obviously hand washing is going to be there, and we have both, but the hand sanitizer is really what we'd like to focus on. So adding value for medical distribution. So somebody who's been in sales, been in regional management and training, we want to provide you with the support, education tools you need, but we know you want to make money too, right? So especially those of you just getting started in your career, we want to make sure that you have everything that you need, and that includes all of our sales and marketing, right? We do have ads, but more than anything, we've got your sales tools. And what I like about what our marketing team has done, it's market focused. So if you've got ambulatory surgery center you're focusing on, you have your entire portfolio there. And same if you're dealing with a long-term care situation or primary care. So we have those trifolds. They're available. Of course, I can provide those, and I will after this call. But they are market specific and really help not only you as the dealer, but the end user as well. Another question I get quite a bit is, okay, well, I'm opening an office. How do I know where to put all of my hand hygiene products? Well, how about my surface disinfection? And same situation. So what we call the perfect placement, we have that for each market as well. And that is a real benefit to the end user and makes your job a lot easier. So clinical education, we have an entire team of experts, as I mentioned. We can provide CEUs, we can provide webinars with the experts. So we can really dig down into a situation that's customized to an end user, and we have an entire team that's capable of that. We do offer promotions and spiffs. I mentioned the stand promotion, and I'll have more information for you on that. So let's talk about our team. So our healthcare field sales team, that's me here. We have Mary Rundle, who some of you may know. Tim Cost handles our long-term care, and Joel Rich, who's my boss, he is our vice president of healthcare. So we also have an entire operations team as well. Our clinical team, our marketing team. But what a lot of people don't realize is we have resources all around the country. This is our healthcare sales director, their geographies. So if there's I'm out of Atlanta, Mary's out of Cleveland. If you ever needed something that is in your territory, needed it quick, we do have resources available on the ground. So this is our healthcare team that typically handles acute care, but they can also help with non-acute. And then we have a whole other sales team, which is our enterprise team, that's really our biggest team that can also help. So we have a lot of resources, not only digitally, but also from a field perspective that can help you guys locally. And here is our virtual rep. So as I mentioned, you can always contact me. I will be there anytime you need me. Mary's the same, but we also have several different email accounts that you can utilize for inside sales support, clinical education, tech support, customer service, field sales. If you need samples or literature, this is a mailbox that goes to multiple people, and to make sure that you guys get answered really, really quickly. So as far as sustainability, that is something that is certainly important to not only to Henry Schein, but to GOJO. So from an environmental perspective, from a green perspective, Purell, we've been really focused on that the last few years. You can kind of see all the different awards that we've won or the certifications that we have. And then kind of walking the walk here, we earned the EPA's design for an environmental certification and lowest toxicity rating, which is category 4. So the newest ES10, 30% less plastic per refill, 38% lower greenhouse gas emissions. So we are, as I mentioned, we walk the walk when it comes to this type of stuff. So the key takeaways, guys, we're at 25 minutes, so that's pretty good. Key takeaways here that we do have our dispenser program, so we will send you guys our dispensers for free, and then you guys benefit by getting the refill, getting that recurring revenue on the refill. So please reach out to us. You can utilize virtual rep, but that's one of the biggest takeaways. And the other thing is, when I think about products that you guys can take out first when you go into a new office, if it's a cold call, hand hygiene, specifically Purell, with that brand power, that's something you can pull out first and talk about it easily, because it's not that complex. Certainly it's more layered than you would think on the surface, but that is something you can talk about with your customers and make them understand how important hand hygiene is, especially with what we talked about with the healthcare acquired infections and what's happening in our healthcare facilities with almost 100,000 people dying per year. So that the stand promo, and then also the other support items that we provide for you guys, we want to make sure that you have that ability to access all that information, and I'll make sure that I'll send out the most popular ones as well. So that is it. That concludes the Henry Schein new hire training. I'm going to pause now to see if there's any questions from our group.
Jason, I'd tell you, man, I think this is awesome. And please don't be deterred because we don't have people on here. There's a lot of things going on, and there may not be people that this touches today that need to hear this in the midst of us transitioning territories. But one thing I'll tell you, dude, is we are going to be over probably the next 6 months to a year, seeing a lot of turnover within our business. So we're going to have a lot of retirements. We're going to have bringing on new reps. We're going to be moving those retired territories into probably 2 or 3 new smaller territories. So this is the type of stuff that is going to be a home run for them. And I think this is a product that they can embrace. Like, I know soap, I can go sell soap. Some of the products that we deal with are just such a big topic, they shy away from. We just got off some lab calls earlier. That's a harder sell for us, for them to get in and actually sell the technical side of a lab. This is something that they can embrace quickly. So this is a huge help for us. And I'm glad we recorded this to be able to have this hosted somewhere, so that as we go through this transition and evolution of our sales teams, we can get this in front of them. So as you've got a new rep in the field, you can quickly start to see the needle move with regards to this type of product category. So I think this is awesome. So please do not be deterred to think, hey, this was not a waste of time. This is awesome. You guys have pulled this together, and we will absolutely make use of this. So I appreciate what you guys are doing here.
Yeah, thanks, Chris. So this is the first time that I put these slides together specifically for this group. So I'll be glad to do this anytime that you need me to. Certainly the feedback will help to tailor the message to maybe more of what you guys are seeing in the field. But absolutely glad to do it, and just want to make sure this content is what you guys need. And so and I thank you guys for the opportunity.
Hey, Jason, this is
Jason. I'll echo.
Regional
Thanks,
manager.
Jason, I'll echo. I'll echo what McD just said. And if we could, again, I apologize, I'm on the phone. If you haven't, let's upload the presentation into the chat, and then that way, when we share the recording, they'll have the actual deck as well too, if you're okay with that. And we'll make sure to get this out to our new folks.
Fantastic. Thanks, Bruce.
Thanks, guys.
Hey, Jason. Tisdale, RSM in the Northwest. One, I wanted to reinforce what Chris and Bruce had just said. Part of this, a little bit of the onus lies with me. When I saw the invite, when I hopped on the call, I realized that my new people weren't included in the invite. So I sent it out to them at the very beginning, but that might have been a little bit on our part. So in the future, if you have these, if you want to make a little note to the RSMs and make sure that we forward that on to our individual people, you'll probably get a lot better representation. The other question I had was real quickly, have you guys ever considered, or have we ever had conversations about when the Purell dispensers are out there, we're going in, we're taking over new customers, and we want to introduce your product. Is there a co-branding kind of sticker or anything that we could put on the dispensers that you send out?
So
That
yes,
might have
yes,
Schein sticker?
that is a conversation that we've had. It's not necessarily something we've spoken about with ES10, but Kurt, well, that's certainly something that we can take offline if there's specific circumstances. Because yeah, we want to make you guys happy there. We talked about a surgical scrub as far as co-branding, but we have not gotten into the ES line. But we can have that conversation.
Okay, just curious. Thank you. Appreciate the presentation today, guys.
Thank you.
Hey, Jason, I'm just going to follow up real quick on the commentary about this. This is really truly a category, as you said, Chris, that this definitely resonates with all the sales reps. I always say Purell is probably America's easiest add-on sell. You may not be walking in as a rep that day to sell Purell sanitizers or soaps, but every customer that your reps are calling on are absolutely buying a soap or sanitizer from somewhere. And most likely in the healthcare, they're buying a Purell branded product. So why don't they buy it through Henry Schein? And so I think when we really think about what you can do and the revenue that can start coming through, we see it as a big opportunity, not just from the individual level, but from the regional level, all the way up through the zones and through Henry Schein as a whole. If you think about an average physician office spending somewhere between $500 and $1,000 a year on the category, one office doesn't necessarily move the needle, but 10 offices becomes $5,000 to $10,000 when you have 10 reps that are out there finding opportunities to go through things. And when you put that multiplier out there, this can make the needle move very quickly in a product that, for all intents and purposes, we're giving the customer the dispenser at no charge with a product and a formulation that's unrivaled in the category. So we would really appreciate, again, the partnership with Henry Schein. Jason, thanks for taking the time to pull all this together. And to you guys, we really appreciate the partnership and really look forward to driving this into 2025 and beyond. So thank you for your time.
Thank you.
Great. Thanks, everybody.
Thanks, guys. I'll do my
Thank you.
due diligence with the follow-up and emails, and we'll be in touch soon. And I'll see
Awesome.
some of you guys
Sounds good.
tomorrow or Wednesday.
The roadshow continues.
Absolutely.
All right.
Thanks, Jason.
Bye, guys.